My name's Mark Swift. I've worked in the health and care system for nearly 15 years now. My vision for system change in the health and care sector is that we'll arrive at a point where doctors and nurses will work in collaboration with the communities to bring about better health outcomes. So I want to see people power as an integral part of helping people to stay well across the life course. And what might that look like? So community members are active in helping people at various stages in their lives, that we're responding more appropriately to people's social needs, because of course medicine can be a blunt instrument when we know that the root cause of those illnesses lies in the social. So how do we better respond to people's social needs around housing, debt, unemployment, helping people to overcome loneliness and isolation? And for me that requires a paradigm shift and recognising that actually medicine is as equally important as the social approaches that we can harness as well. So this work is really important because our NHS, our social care services are under extraordinary pressure, as are our communities. We're seeing grotesque levels of inequalities play out in communities, which is having a profound impact on people's health and well-being. Now, the NHS in its entirety can never be big enough to respond to those social issues. And we know from the research of people like Michael Marmot that actually health is socially derived. It comes from the conditions we are born, we live, we grow up in, and we age. And so we have to find better ways of responding to the root causes of health issues. And at the moment, we're predominantly focused on a medical paradigm, using medical treatments to address those problems, but medicine will not be the answer. So WellBeing Enterprises was one of the first health and wellbeing community interest companies to set up in the UK back in 2006. We have a special interest in what's being called community-centred approaches to health. So how do we leverage people power and the assets of our community? We provide services, for example, like social prescribing, so providing non-medical prescriptions, prescriptions for confidence classes, life skills training, chances to meet new people and learn new skills, have fun and feel good. Our strategy and our tactic has been to engage in courageous conversations with leaders in the health and care system. And to say, if we were to reimagine health services so that they're fit for the 21st century, what would need to change? And what role would our wider stakeholders play to ensure that those services are delivering the kind of outcomes that the people we serve deserve? That's our strategy, if you like, to engage in courageous conversations, develop social models of health, and deliver services like social prescribing, like volunteering, community navigation, where we connect patients to wider based support that's available in the community. And we found that when we do that, we are delivering outcomes that are often on a par, if not exceed, clinical treatments. But actually by working with our clinical colleagues, we're able to augment those outcomes. So there is a place for medicine responding to medical issues, but there is also a place for a social paradigm of health where we recognise that the root causes of those concerns lie in the social. So we work very closely with colleagues in health, social care, and with our partners in the voluntary sector to ensure that we can target our resources at those in greatest need. So we look at what our health intelligence, our data tells us about where these people are, what their needs are. We then go into those communities, we build relationships with people, we get to understand what their lived experiences are like and what the barriers are to being able to live a healthier life. And then we finally work with our clinicians and our health colleagues as well, those individuals working on the front line. And by bringing those three insights together, the conversations with communities, our data and our intelligence, and the wisdom and knowledge from our health and care professionals, that gives a very powerful lens through which we can focus our resources to ensure we're reaching out to those people who are in the most need. And that's really important when resources are stretched. Well, to date we've supported more than 28,000 people to make demonstrable improvements in their health and well-being. When we look at our data, we've got a very large data set. We're finding that our outcomes are on a par and in many instances exceed those of clinical interventions. We've recently commissioned some economists to evaluate the return on the investment placed in us. When we look specifically, for example, at our social prescribing programme, we've been able to evidence through a cost-benefit analysis that every pound invested is generating £12.14 in terms of cost savings to the wider healthcare economy. So not only can we deliver better outcomes, but we can do it in such a way that it is cost-effective and it creates a long-lasting legacy of community members and partners working together to mobilise people power. We're really keen to build relationships and links with lots of different partners, voluntary organisations, schools and colleges, NHS and social care teams, because we believe fundamentally that there is strength in solidarity. And this issue, tackling these health challenges, is bigger than any one individual organisation. So we've invested a significant amount of time building a shared narrative, a shared purpose with our partners, and shared values that transcend our individual organisations. And by doing so, we are able to focus all of our attention on the purpose, the core purpose, which is ultimately around improving the life chances of people in our communities and ensuring that they live the best possible life with dignity and with value. I think it's probably fair to say that we've had some success changing the cultures within health and care systems. We've carried out some qualitative research with partners. We've shown that nurses and doctors are much clearer about the value of social approaches to health. And actually we've seen that follow through in the numbers of referrals that we receive from health and care partners as well. The thing I'm most excited about is the way that we've sort of mobilised a community to share its ideas and to push forward with the change that they want to see. We're really proud to have funded 31 local patients who have their own personal ideas about how we might improve health and well-being. We funded veteran Airfix model playing clubs, we funded pop-up cafes, environmental activists. So this is a beautiful example of both change at a sort of senior level and then bottom-up change, and I think that's what we need. We need a pincer movement to bring about the kind of transformation that we require in health. And then finally, we've done some work with academic partners trying to visualise the community networks and connections that have emerged since we've begun our work. And we found the first tantalising evidence to show that actually through a social model of health, we've been able to reconfigure those networks so that partners across a wide range of sectors work much closer together. And those new networks allow for resources and insights to flow much more freely. And that is the seedbed of social innovation. So I'm more than confident that we're well on our way to driving and pushing the vision that we want to see, but there is lots more work to do to ensure that this vision spills over as a social movement across the whole of the UK. There have been a number of challenges along the way, as you would expect when you try to push for change. I think some of the most pertinent challenges I've faced have related to how we communicate our message to leaders in the health and care system. So it's learning the discourse and language, learning the fine art of being able to rock the boat but without falling out of it, I think is a key one. So I created this organisation back in 2006, and when I started out, my vision was that I would create an organisation that drove change. And actually what I've come to realise is that it's not at all about the organisation. It's about a movement, it's about a collective. And I've come to appreciate how important it is that we bring people together to push for the change. And I sometimes see very meaningful people trying to push change within their institutional boundaries, within their organisational boundaries. But actually, we need to step out of those. Actually, what we need is a shared vision, a vision that transcends those organisational boundaries. Because actually, if we end up fighting each other, we miss the real enemy in the room, which is the systems and structures that shore up the inequalities that create the problems that people like myself and others have to tackle. The reason I'm doing it is because I have come from a regular working class town community where I see every day people fight against the odds to try and live a valued and dignified life. And unfortunately for lots of people, they're never able to realise their potential because of the circumstances that they were born in. And that for me gets really to the core of my being. I want to live in a world where people are afforded opportunities based on their capabilities, not on how much money their mother and father had before them. And I wonder what kind of world we would live in if those people with those real skills and talents were able and afforded the opportunity to get in the jobs where they could bring about change too. And that's my goal and mission, that we'll redistribute power and opportunity to people, and then ultimately an outcome of that will be better health and well-being for everyone. If we reimagined health and social care, what would it really look like? And who would play a part in the delivery of that system? And I put it here that actually it's as much about doctors and nurses as it is about the everyday man and woman on the street. And actually it's in collaboration that we will really make a difference.